Now we start with case chapter 35. 35, that is the prognosis after observing the action of the remedy. Means we give a remedy to patient. After that, what is the outcome of the patient? That is written in chapter 35. There is certain observations. There is popularly known as Keynes 12 observations. Keynes 12 observations. Total number of 12 observations is there. So it's popularly known, but in should name Keynes 12 observations. ठीक है? Observations. But this name is not fulfilling the purpose. Purpose is what Keynes written the name of the chapter. Means after giving a remedy, we observing the patient, fate of the patient. What are the changes of the patient? The changes of the patient written. What is the prognosis, the outcome of the patient, and accordingly we have to some changes. So that is give the prognosis after observing the action of the remedy. Remedy is acting. If you give some medicines, the remedy is acting. After that, you have to prognosis the case. What is the patient is in good condition or bad conditions or whatever the conditions. So that conditions can written in total 12, total 12 observations, the outcome. So first examiner says what Keynes actually want to do. Actually, in this observation, he done the prognosis after giving a remedy. Remedy, after giving remedy, there is certain prognosis. So that prognosis fall up. Similarly, if we go to, for example, the first one, there is 12 observation. That's first observation. Observation number 1. What Keynes says? First observations. If you go to the Keynes, according to Keynes language, if we go to the a prolonged aggravation, then final decline of the patient. If you go, the first observation, a prolonged aggravation and final decline of the patient. Means a prolonged aggravation. Prolonged aggravations, then final decline of the patient. Means what it means? Patient come to you, intensity of disease, in respect to time. Patient come to us, we give certain medicines. In this point, patient come to us, we give medicines. After giving medicine, hopingly we want the patient to be improved. But here patient is not improving. Patient is gradually deteriorating, aggravating, and ultimately patient die. Patient gone up. So, what we learn from this? এখান থেকে আমরা কি শিখছি? We learn from this and what to do. Prolonged aggravation means the medicine is given. Medicine is aggravation means we know there is homeopathic aggravation, medicinal aggravation, disease aggravation. There is nothing medicinal symptom. It is not medicinal aggravation. Disease is continuing, not like that. Disease was prior to that, but after giving medicine, it started aggravations. Means here patient is structural changes. First one, patient come to at end. ठीक है, सब कुछ ट्रीटमेंट करा लिए, उसके बाद पेशेंट इज कमिंग. Patient is ultimately in pathological changes occurs, and so much pathological changes occur That is the cannot come to the reversible phase, irreversible pathological changes. Rather, a case of gangrene or metastasis or whatever. That patients come to the end. Already there is changes to occurs. That is the fault of the patient. Fault of the physicians. Physicians here give the most similar medicines, a deep acting medicines, deep acting anti-miasmatic, antisodic medicines, and is given in high potency. Huh? Suppose any deep acting antibiotic medicine, maybe sulfur or anything, is given in 10 or cm. Huh? High potency. Physicians giving a deep acting antisodic, and patient cannot cope up with that antisodic. Patient vitality is too low. Patient is suffering so much, the patient vitality is too low. After giving medicine, it causes aggravations. Aggravation is so severe that body cannot tolerate that aggravations, and it going to gradually deteriorating, ultimately patient die out. So in this case, what to do immediately? When these type of aggravations come, we learn from that patient may die. So in that case, immediately you have to antidote. Fault of the physicians given deep acting antiseptic. In this case, should not be given a deep acting antiseptic because patient already saw gross changes occur, gross pathological changes occur. So that cases we should not give a deep acting antiseptic. A short acting palliative remedy or something given. But here deep acting even high potencies. That high potency patient cannot tolerate. So here immediately in that case, suppose we given that sulfur. So immediately in that aggravations occur. So immediately we have to give some antidote. So medicine action should be exhausted. Otherwise patient may die. Right? So that case you have to immediate antidote. In any case. Understand? So that is the first one. Second one is the same thing. Gain. The Kent का writing में बोलो, a prolonged aggravation, then final decline of the disease. What have we done? Physicians, what he have done? It has been a mistake of physicians. Right? The antisoric was too deep. Patient को जो medicine दिया है, that is too deep. Deep acting है antisorics. It has established destructions. Medicines क्या करेंगे? Medicine cure करेंगे, but medicines instead of cure, it going to destructions because antisoric is too deep. It goes to destructions. In this state, the vital reaction was impossible. He was an incurable case. Patient was an incurable case. That incurable case, deep acting antisoric is not going to cure. Instead, it is going to destructions. Destructions. Going to destructions. The question is immediately comes up, what are you to do? So that questions, अभी क्या करेंगे? What you to do? क्या करेंगे? Are you not going to giving homeopathic remedy in such cases? Not giving homeopathic remedy. Such cases, the patient is steadily declining. Gradually, patient condition is declining. If you are in doubt about such actions of the remedies and making patient worse, you will probably have an undertaker certificate signed. That is, for your confidence, नहीं तो patient court में जाएगा तो फंसेगा. Undertaker certificate बोलो, ठीक है. In incurable and doubtful cases, give no higher than 30 or 200. So incurable cases, not more than 30 or 200. Kent says, not to give it too high potency. Potency इतना नहीं देंगे. And observe whether the aggravation is going to too deep or too prolonged. And you observe that aggravation is too deep or too prolonged. There are many signs of the chest in such cases to make a physician doubt whether you will give deep remedy when the organic disease are present. Of course, this does not apply when the things are only threatening, when you have fear of their coming, but when you are sure of their being present, In the instances given, probability of the remedy has been too late and has attempted to arouse economy but turned to destructions of his whole organisms. Then begin in such cases with a moderately low potency, and 30th is the low enough for anybody or anything. So in that case we started with 30 because Kent all use centesimal scale. So Kent given medicine in centesimal scales. Kent never used 15 decimal. So centesimal scale, a moderate started with 30, not too high potency in incurable cases. Similar things in the second one. Second one is the most similar one. First one and second one. Second one may Kent says long aggravation and final and slow improvement. First and second we are observing. Second one, long aggravation, then final and slow improvement. Means it like same like the first one, that aggravation is going on, long aggravations, but here patient die. But here patient is ultimately somehow cope up with the situations and started improving. Improve कर रहा है. क्यों? What is the difference between first one, second one? Because first one is the cross the incurable, and cross the this is the pathological borderline. Borderline. It is the reversible. Second one is the reversible phase. First one is the irreversible phase. And patient is first one come too late. Irreversible conditions already. Incurable condition. Irreversible. So irreversible phase, patient cannot come up background that conditions. But these conditions, second one, patient is reversible phase. Pathologically reversible phase. Although borderline state, but so somehow cope up with the situations. Aggravation, destruction occurs, ultimately somehow cope up with situations and improvement starts. This is the Porikha exam asked, what is the difference between first one and second one? That is the pathological changes. Pathological changes in first one, second one. First one is the incurable phase, second one is the reversible phase. First one is the irreversible phase. Patient cannot, like a gangrene or something, metastasis or something happens. That patient cannot carcinoma or sarcoma, whatever may be, patient with metastasis. Here is borderline conditions. Second one is the borderline. You can cope up with that situation and back to the normal conditions. Reversible conditions. First one is the totally irreversible conditions. So that is the pathological difference between first and second. Otherwise both are same. Here is also deep acting antisorics. Reversible phase. Second one, both are same. Both are deep acting antisoric given in high potency. Fault of the physicians. But first one, in patient side, first one is the irreversible condition. Second one is the reversible conditions. Patient come early. Pathological difference. High dose, high potency. Deep acting antisorics, deep acting medicines, high potency. But second one is somehow cope up with the situations. So if you go to the second one, Hahnemann says, Kent says, if the end of the few weeks, he is little better and his symptoms are little better, that when he took the dose, there is some hope. Finally, the symptoms may have outward manifestations, whereby he will attain final recovery. But for many years, you may go along with prolonged aggravations. You will find such a patient, there is the beginning of some very marked tissue changes of some organ. We may know by observing the action of the remedy what state of tissue are in, as well as know something about the prognosis of the patient. So always doubtful cases you started with lower potencies. Huh? 30 potency. When there is a doubtful, should not be go to the higher potency. Started with lower. ঠিক আছে তাহলে দুটো you have know the first one, second one, two observations. First one is the prolonged aggravation, final decline of the patient. Huh? Prognosis not good, very bad. Huh? But here prognosis long aggravation but slow and final improvement. Prognosis not good but favorable, not bad. Huh? Here prognosis always bad. But here prognosis is not good but favorable. You can say favorable. Ultimately patient somehow cope up with the situations. Favorable. Huh? So ultimately patient is improving, ultimately patient come up with the situations. That's it.